Hi there, this is Debbie Garcia. I'm going to be going over my bone video appendicular skeleton assignment. And I apologize I'll be on the floor, but I could kind of adjust things this way rather than standing upright. The appendicular skeleton is the bones of the upper and the lower extremities, um, including the girdles, that the bones that connect the extremities to the axial skeleton. We'll be going over the pectoral girdles. The pectoral girdles is a set of bones which connects from the upper limbs to the axial skeleton on each side. It consists of the clavicle and the scapula in these areas over here. The sternoclavian joints are on each side here. And the clavicle acromonal end and the sternal ends. The pelvic hips. The pelvic girdle consists of paired hip bones connected in front of the pubic symphysis and behind by the sternum or the sacrum. Each is made up of 3 bones, the blade-shaped ilium above and to either side, which accounts for the widths of the hips, the ischium behind and below on which the weight falls behind sitting, and the pubics in front. All 3 unite in early adulthood at a triangular suture and the accipitulum, the cup-shaped socket that forms the hip joints with the head of the femur and the thigh bone. The scapular area, I'll kind of rise it up here, is the corticope process, and this area, I'll try to twist this, in this area here. The subscapular fossa is the larger main piece in this area here, in this area. The glenoid cavity is in this section in here. The spine would be in the back area. The acromion is this little tip here. The suspension fossa is basically in the middle of the left area here. The infractions fossa is the lower piece here. The sternoclavicular joint is from the top. It's near the top of the spine here. And the amygdaloclavicular joint is near the bottom of the spine. We now go into the arm. And the humerus is basically the arm bone. The head is basically this area on the top. Or, yes. The greater tubercle is in this area. The lesser tubercle is in this area here. The deltoid arm is this area in here. The medial epicondyle is in this area. And the lateral epicondyle is in this area. It's actually superior to the anterior portion of the trochleus is a small depression, the cornuate fossa, which receives the cornunoid process of the ulna during flexion of the forearm. It is directly adjacent to the radial fossa of the humerus, and that is the capitulum articulates with the ulna, radius, and the scapula. The trochleus is the articular surface of the elbow joint here. I lost my face here. Is the back part of the trochleus of the humerus is a deep triangular depression, the occiput fossa, in which the summit of the occiput is received. So we're going to go into the forearm, and the ulna would be here. This would be the occiput, the ornacode process is this area. Style of process is this part in the back. The radius is this area. The head is up here. The radical tuberosity is the space in between, and the styloid process is this area here. We'll go on to the hand portion. This is the proximal row, and it is the four bones here. It's the scaphoid, the lunate, let's see that, the lunate, the tractile, and the pistophore. And this is the trapezium, the trapezoid, capitate, and the hamitate. There are 15 bones that form the connections from the end of the forearm to the hand. The wrist itself contains 8 small bones called carpal bones. These bones are grouped in 2 rows across the wrist, so it'll be in these 2 areas here. The phalange bones, formosa, with the pollex, which is the metacarpals, which is the hand, and the phalanges, which are the fingers. The tarsus is, try to move this so we can see this a little bit more better at a different angle. Let me see that. Yeah. The talus articulates the front of the foot with the Achilles heel bone and the navicular bone. It also articulates the bones of the leg, the fibula, and the tibia, and the tibia. And the calcaneus is the top of the heel. The cuboid is this area here. The navicle is on the back side here. Oh, I'm sorry, I'm not even showing this to you. The callus is the top. The cuboid is back in this area. The navicle is the back part. The medial, intermediate, and lateral cuneiform is from this side to that side. The metatarsus is the toes, is the toe. The phalanges is past the toe, and the hallux is the fat toe. We'll go on backwards to the pelvic girdle, which is in this area, the coaxial bones. See, this side would be area is acetubulum. The pubic symphysis is here. The arbitral forum is here. The iliac crest is this area here. Anterior superior iliac spine is the back slope. Iliac fossa would be on the left side. The greater sachet notch is the back section in this side. This back side here. The ischial spine is the lower back of the spine. The ischial tuberosity is this would be this area here. We'll move on to the thigh bone, or the femur, and it'll be, this side will be the head, actually it would be this area would be the head. The greater trochanter, sorry, is this area here. The lesser trochanter is this area. Adductor tubercle is this area. The medial epistine, apologies, is this side here. The medial and lateral condyles are in this area, and the patella is here. The lower part of the leg, I'll try to rise that up and push this back. Don't fall on me. Here we go. See this is the medial and lateral condyles. The tibial tuberosity is the center area. The medial is the back area, malleus, the medial malleus, and the proximal distal tibial forms is this area here. Then the fibula is the smaller and backbone here. This would be the head, and the bottom part would be the lateral malleus. Apologies for some of the exposure here. I thank you very much. This concludes the end of my assignment here. Thank you for your patience, and I hope this turns out well. Thank you so much for viewing this video.